The surprising benefits of coffee for hypertension management. Hypertension, also known as high blood pressure, is a chronic medical condition in which the force of the blood against the walls of the arteries is consistently high. This condition can lead to various health problems, including heart disease, stroke, and kidney failure. Prevalence of hypertension. Hypertension is a prevalent medical condition, affecting approximately 1 billion people worldwide. In the United States, around 45% of adults have high blood pressure, according to the Centers for Disease Control and Prevention, CDC. Importance of hypertension management. Hypertension management is crucial in preventing these health problems. Treatment typically involves lifestyle changes such as exercise, weight loss, and dietary changes, as well as medication. However, recent studies have suggested that coffee consumption may offer surprising benefits for managing hypertension. Understanding these benefits may provide alternative strategies for hypertension management. Coffee and hypertension. Overview of coffee consumption. Coffee is one of the most widely consumed beverages in the world, with more than 400 billion cups consumed each year. Coffee contains numerous bioactive compounds, including caffeine, chlorogenic acids, and diterpenes. The link between coffee and hypertension. For many years, coffee was believed to be a risk factor for hypertension due to its caffeine content. However, recent studies have suggested that moderate coffee consumption may actually have a beneficial effect on blood pressure and hypertension management. The active compounds in coffee that affect hypertension. Several active compounds in coffee have been identified as potentially beneficial for hypertension management. For example, chlorogenic acids and diterpenes in coffee have been shown to have anti-inflammatory and antioxidant effects, which can help protect against hypertension. Additionally, caffeine in coffee has been shown to increase insulin sensitivity and improve endothelial function, which is important for regulating blood pressure. Overall, these compounds may work together to provide surprising benefits for hypertension management. The surprising benefits of coffee for hypertension management. Improvement in endothelial function. Endothelial function is the ability of blood vessels to dilate and contract, which is essential for regulating blood pressure. Coffee consumption has been shown to improve endothelial function, potentially through its caffeine content and the presence of other bioactive compounds. Reduction in inflammation. Chronic inflammation is a risk factor for hypertension and other cardiovascular diseases. The polyphenols in coffee, including chlorogenic acids and quinates, have been shown to have anti-inflammatory effects, which may help lower blood pressure. Antioxidant effects. Coffee is a rich source of antioxidants, which can help protect against oxidative stress and prevent damage to the cardiovascular system. Antioxidants such as chlorogenic acid and caffeic acid are present in coffee and have been shown to have protective effects against hypertension. Increased insulin sensitivity. Insulin resistance is a risk factor for hypertension and other cardiovascular diseases. Coffee consumption has been shown to increase insulin sensitivity, potentially due to its caffeine content and the presence of other bioactive compounds. Reduction in blood pressure. Several studies have found that regular coffee consumption is associated with lower blood pressure. For example, a meta-analysis of 28 studies found that moderate coffee consumption was associated with a 3 mm of mercury reduction in systolic blood pressure and a 2 mm of mercury reduction in diastolic blood pressure. Overall, these benefits suggest that moderate coffee consumption may have a role in hypertension management, especially in combination with other lifestyle changes and medication. However, it is important to note that individual differences in caffeine tolerance and potential health risks associated with coffee consumption should also be considered. Potential risks and considerations. Individual differences in caffeine tolerance. The caffeine content of coffee can vary widely depending on factors such as the type of coffee, brewing method, and serving size. Some individuals may be more sensitive to caffeine than others, and excessive caffeine consumption can lead to side effects such as jitteriness, anxiety, and insomnia. Other potential health risks associated with coffee consumption. While coffee consumption has been associated with several health benefits, excessive consumption of coffee has also been linked to some health risks, including heart palpitations, increased blood pressure, and gastrointestinal problems. Additionally, coffee can interact with some medications, so it is important to consult with a healthcare provider if you are taking any medication. The importance of moderation. While moderate coffee consumption may provide some health benefits, excessive consumption can have negative health effects. The American Heart Association recommends consuming no more than 3 to 4 cups of coffee per day. It is also important to note that adding sugar and cream to coffee can significantly increase its calorie and sugar content, which can have negative health effects. Therefore, individuals should consider their individual caffeine tolerance, other potential health risks associated with coffee consumption, and practice moderation to maximize the potential health benefits of coffee consumption while minimizing the potential health risks.